A very good evening to all our viewers today. This is Dr. Anjana, your host for this evening from Coachminister. Today we have with us Dr. Biju, who is a doctor turned healthcare management professional, now working as the academic director and CEO of Viegyan Academy, who runs various courses for healthcare professionals in the areas of genomics, nutrition, and health coaching. He also serves as the medical advisor to Vieroots Wellness Solutions, which is a sister concern where Vieroots is a health tech company which provides lifestyle modification solutions to their customers after analyzing their genetic and metabolic data. He is a postgraduate in management from IIM and he easily handles multiple roles from a manager to a teacher to a doctor. So let's not waste any further time and let's welcome Dr. Biju to this very interesting podcast where we will be discussing about entrepreneurship for all the medical professionals. Welcome, Dr. Biju, for this podcast and thank you for accepting our invitation.
Pleasure is mine, Dr. Anjana.
Yeah.
Okay.
So
thank you for accepting me as a podcast guest of your Coachminister podcast handle. As Dr. Anjana said, to all the viewers, let me introduce in a very brief manner. I'm a medical doctor turned management professional. When I'm saying a management professional, you might be wondering why a doctor actually turned into a management area. Let me tell you that even this day also, I did my practice in medicine. Okay, I have done with my practice and then I came for this podcast interview. On Saturdays and Sundays, I used to have my consultations with my patients. On Monday to Friday, I will be working as a management consultant and working as the CEO. And sometimes used to take classes for my academy also.
Right. So Dr. Biju has been a constant juggler, and it's really amazing to have you here with us today. So let us start off with your early education and early medical education. So how did you land up with your medical education? Can you just brief us about that?
Thank you for asking, Dr. Anjana. For that, I need to go back around some 25 years back. Actually, I was born and brought up in a middle class family, and I come from a remote village from Kerala, one of the southernmost
Right.
parts in India. I did my schooling from usually the government run school, the normal government run school. But my father was a multi skilled person, I can say.
Hmm.
He did run his own multiple business and shops, and he was also into farming. Even though
Okay.
my taste was into engineering, my father always wanted me to become as a doctor. So I wrote
Right.
medical entrance examinations and I got homeopathy. But I didn't go for any higher options since I was determined to change my profession maybe after 1 or 2 years. But
Okay.
unfortunately, after the second year, means the first year uh, exams, during my exams, I lost my father. And the
Oh,
circumstances made me to continue this profession of medical graduation.
right.
I lost my father due to various lifestyle diseases, say diabetes, say heart attack, say he was suffering from chronic renal failure also.
Right.
So I was searching for some solution for these lifestyle diseases, and I
Hmm.
decided to stay back on this medical profession, so that
Hmm.
I pursued my post graduation also in medicine. And after my post graduation, I was working with a small hospital, and later I became the investor in that particular hospital also. So
Okay.
that's the journey of my career into this medical profession.
Right, right. Okay, that's an interesting one, albeit a bit sad one, but I think that paved the way for your further course in the medical field, right? So,
Exactly.
yeah, coming to your stint at IIM, I mean, that's a big name. And what incident propelled you towards taking this course into IIM, and how did you land up in IIM basically?
So that's a great question, doctor. So during my practice, especially as I told you, treating lifestyle diseases in
Hmm.
that small hospital, I got full charge of managing the hospital. And as I said, later on, I did some investment on the hospital. And I really wanted to scale it up.
Right.
To be honest, I failed. So I
Okay.
decided to learn some new business skills. So I checked with the business schools admission process, and I realized that IIMs are the topmost MBA colleges in India.
Hmm.
One of my friend's brother was an IIM graduate from IIM Ahmedabad,
Okay.
and I had a conversation with him. It was really a life-changing conversation for me
Okay.
because he asked me why MBA,
Hmm.
and my answers to him seemed convincing for him, and he told me to prepare for CAT exam,
Hmm.
and thus I landed in IIM. My intention was not to get into a 9 to 5 job per se, but purely to build a business.
Right. Right.
So it felt like the perfect way to bridge the gap between my medical knowledge and also the business skills.
Right. Yeah, I think here I would like to add, and I think you will also agree to this point that, I think in medical field, especially in the medical education, nowhere in any of the years are we taught about, how to handle a clinic or whatever it is. Entrepreneur skills or management skills are never a part of our medical education. I think that can be one changing aspect in our medical field, education especially. And definitely we are here today to discuss about entrepreneur skills for the medical doctors. So who better to have than you, because you have had that experience and you are running successfully your businesses, and so it's great to hear directly from you. So I want to ask you here that how has your education at IIM influenced your career path so far?
So my education at IIM, this was, I can say it was a highly transformative one. It
Right.
equipped me with the valuable skill sets like business skills, like leadership skills, like strategy, like financial management.
Hmm.
So today, I can confidently navigate between the business aspects of the various aspects of healthcare
Hmm.
initiatives that I'm doing right now, and to make some informed decisions that will definitely going to help the clients and also the
Right.
management.
Right.
So the
Right.
study methodology during my medicine and business is entirely different. As you are a doctor, you know about it. So during my medical studies, I need to mug up a lot of theoretical knowledge,
Hmm.
which has little practical value. I'm not
Hmm.
demeaning the medical education, but maybe some 50-60% of what I learned through the theoretical knowledge, what has not any use in my practice.
Right. Right.
But we need to learn for sure.
Hmm. Hmm.
But my business studies in IIM was totally different, where professors don't teach the textbooks per se, but only case studies. Means
Right.
only practical applications. I mean, the teaching methodology, the
Hmm.
networks that we are used to exposed are some of the
Right.
factors which make these business schools stand tall always at the higher positions.
Hmm. Right. Perfect. Okay. So you mentioned about education and coaching for that. So how was your experience at NIN? Because NIN Hyderabad, is one of the premier institutes for nutrition education and lifestyle coaching and all that. So how was your experience over there at NIN?
See, the National Institute of Nutrition has been running a course for the healthcare practitioners,
Hmm.
those who have completed MBBS or any other medical allied medical system. Even
Hmm.
BDS doctors also can join. That's a
Yes.
short-term course, but it actually paved the way for me to understand the great or vast topic of nutrition per se. But
Right.
whatever actually I am implementing in my practice, that was the foundation I got from NIN.
Hmm.
But after that foundation, I really built my knowledge throughout these years.
Right. Very true. Very true. I mean, as you're practicing it on a daily basis, definitely your basics at NIN has been helpful, and you're continuing with that, and that's really great to know about it. So, can you talk about, lifestyle medicine, functional medicine very briefly for all our viewers today?
Sure, sure. See, before moving on to lifestyle medicine or functional medicine, let me tell you about the traditional medicine. As we all know that the traditional medicine focuses on diagnosing and
Hmm.
treating specific disease condition. You name a disease,
Correct.
there is a medicine for it.
Correct.
Lifestyle medicine, on the other hand, it emphasizes the healthy diet habits, exercise habits, stress management to prevent and also the managing different chronic disease conditions. So when it comes to functional medicine, it takes a little bit more step further by
Hmm.
considering more and more individual factors like genetics of the patients, like environment of the patient, their relationship status, their present lifestyle, their
Right.
amount of toxins they actually having in their body, everything.
Hmm. Right.
Yeah.
So, like, my question would be like, what are the differences between the two, or what are the similarities between the two types of medicine that is practiced now?
See, in functional medicine, doctors are actually more into giving nutritional supplements per se,
Hmm.
but in lifestyle medicine, doctors give more importance to lifestyle changes alone.
Changes. Right. Right. Okay. Though, so the changes from within is what is mostly about lifestyle, right? I mean, functional still has some amount of supplementation, is if I'm right.
Yes, you are right, doctor.
Okay, okay, perfect. So, I we also know that you do a lot of social work. You were talking about Monday to Friday you're busy as the CEO and trainer and all that, and Saturday Sunday you're busy in your social work. So, can you just briefly tell us about your social work that you do?
So on Monday today at Friday, I used to work for my company as an
Right,
entrepreneur mode. That means I am the sole responsible person for that P&L. That means the profit and loss statement for that
right,
company. And on Saturdays and Sundays, I'm having my own practice
right,
some 200 kilometers away from my present business is happening, which
right.
is in which I used to treat patients, especially the lifestyle disease cases, for a nominal fee only, very nominal fee only, considering the amount of service which I am giving. So this definitely it can be considered as a social work for per se,
Right, right.
because as I said, when I fixed my ideas to continue my medical education after the death of my father, I realized that these lifestyle diseases are actually the major chunk when it comes
Hmm.
to the entire disease scenario,
Very
and
true.
the present treatment arena is actually not giving the complete solution for these patients.
Correct.
As you know that when it comes to lifestyle diseases, of course, treatment is actually just one side of the coin.
Hmm.
Lifestyle is the next side of the coin. So I
Hmm.
used to uh, I can say educate people with the correct lifestyle, with the correct exercise, with the correct sleep method, with the
Hmm.
correct diet pattern, with the correct relationship, so through which actually I'm helping these patients, and most of my patients are actually seeing their own home physicians, they're taking their own medications, but they
Hmm.
used to come to me for the proper guidance when it comes to their lifestyle diseases.
Right. And I think, as we all know, India is called the diabetic capital of the
Yes.
world. And, the number of cases are increasing significantly day by day. And I think these lifestyle changes and modifications are the need of the hour for treating such cases. And I think nowadays it's even possible to reverse such cases, and I think you're involved in one such program where there is reversal of these lifestyle diseases, and I think definitely that is very much the need of the hour for the current generation in India. Right, okay, that's that's great work that you're doing, and I'm very sure many more patients are going to benefit from your advice and your treatment. So let us now dwell into the main topic for this podcast of today, that is entrepreneurship in medical field. Here, I would like to ask a very maybe a controversial question. I don't know, but do you think medical professionals in India are underpaid, or what is your opinion on that, and why? Why do you feel that?
So your question is the medical professionals, including doctors, physiotherapists,
Yes,
nurses,
I mean
right? Or
medical
just
and
doctors?
allied fields. Yeah,
Yeah.
yeah, medical and
Yeah.
allied fields in general. Do you
So,
think they're underpaid when compared to, because nowadays a lot of medical professionals want to settle down in different countries. They want to travel abroad and start their
yeah.
careers over there. So, what is your opinion on the fact that, because this is a general opinion that medical professionals are underpaid in India? What do you feel? Do you feel it is right or wrong, and why do you feel so? That is my question.
So I cannot provide an yes or no answer per se, because
Okay.
both yes and no can be the right answer. See,
Okay.
compensation for these doctors or any other medical professionals can vary depending upon various factors like their experience, their location,
Hmm.
their
Hmm.
speciality, etc. So,
Right.
as you told that there is a general notion that medical professionals are always underpaid.
Hmm.
See, in India, a medical doctor just passing out from his or her graduation uh, usually won't get the adequate remuneration. I hope you will agree with me. So there are
Definitely, yes.
multiple reasons. Since I'm also running a business, I can tell you that. So let
Hmm.
me address one by one. The first one is demand and supply.
Hmm.
Demand is there, supply is also very high.
Hmm.
Yes, I'm not forgetting the fact that India requires more and more doctors and medical professionals, but it is desperately required in rural areas. So
Correct.
there is a disconnect between the demand and supply.
Hmm.
Demand is more in rural areas, supply is more in cities and
Very,
towns.
yes, very true.
Okay.
Hmm.
So there is a disconnect.
Hmm.
Then comes the lack of skills. When I'm
Hmm.
saying lack of skills, I'm not demeaning any doctors or any medical professionals. It's the skills related to various other areas, like especially in areas like diagnosis for a doctor, uh, acquiring new knowledge about the new developments happening in the medical field, their communication skills, their
Right.
managerial skills, etc. So these are the skills are actually looking for by any companies out there. Then
Right.
another important area which I always feel is lack of adaptability. That
Hmm.
means, let me tell you an example of Ayurveda.
Hmm.
The market share of Ayurveda in the healthcare business in India is huge, as you know about it. But exactly where this business is happening,
Hmm.
I believe it is more in preventive wellness. Okay.
Correct.
Uh, Say, for example, dentistry also. The huge business is happening, I believe, in cosmetic dentistry, not just treating
Correct.
the dental disease per se.
Very
So
true.
the professionals need to adapt to these changes happening in the market.
Hmm.
If anyone right now listening me as a new graduate, if you do have the right skill sets and knowledge, and I don't think you will be underpaid.
Okay, that's great advice, and I think that will be very encouraging to all the young professionals listening to us. Great. So I would like to ask you here. What are the different career options one can take up after a basic medical degree? Here, I'm talking about be it MBBS, BAMS, or BHMS. So, what are the or BDS even for that matter? So, what are the different career options that one can choose after this basic medical degree?
So, doctor, we used to think that there won't be much options, career options after one entering into the field of medicine, but it is not
Hmm.
true.
Hmm.
So, I believe the beauty of medicine is vast array of option.
Right.
Doctors can specialize in particular field, they can
Hmm.
pursue research, they can venture into public health, they can delve into medical education.
Correct.
And this is the era where which the exacting world of medical technology and healthcare management is booming like anything these days, as you know
Correct.
about it.
Hmm.
So when I'm telling these kind of things, these can be considered as general statements,
Hmm.
but let me dive a little bit deeper into it. See, if a civil engineer or even a mechanical engineer, after completion of his or her graduation, may end up in sales job,
Right.
which the graduation has nothing to do with the present job in sales, but the society is okay with it. Am I
Hmm.
right? But if a
Correct.
medical graduate, say a dentist like you or an Ayurvedic doctor, ventures into any other job, even if the job is very relatable to what he or she studied, the
Hmm.
society will always ask why.
True.
So you need to be ready to hear that question. You should have that answer for that particular question also.
Right.
So please understand, technology is advancing these days. Say, for example, I know there is a startup working in the field of diagnosis.
Hmm.
The founders are techies and
Okay.
has no knowledge in diagnosing a disease, as you know
Hmm.
about it.
Hmm.
They require doctors, they require physiotherapists, they require radiologists. This is just an example I'm taking. So, what
Hmm.
I'm trying to convey you is the options are endless if you have the
Right.
right mindset and skill set. I repeat, the right skill set.
Right. Okay. Okay. So, speaking about skill set and all that, so do you think doctors can be good entrepreneurs? What is your opinion?
That's a very tricky question, doctor. So, because from my experience, I can say that, not my experience, what I did some research on it, the
Hmm.
answer is a big no.
Hmm.
All doctors are not good entrepreneurs.
Hmm.
Because I did a research during my MBA studies and found that around 75%, that means 3 by 4th of the
Right.
doctors failed while starting their own ventures. Even I also failed when I started my businesses initially.
Hmm.
I'm not discouraging anyone
Hmm.
right now listening me by saying this, but
Right.
these statistics can be changed if we medical professionals, say it a doctor, say it a physiotherapist, say it a nutritionist, if we are ready to accept
Hmm.
what we are and what we are not.
Hmm.
Say, for example, some doctors who were working with a famous hospital here in my city decided to quit and start their own business. That means start
Right.
their own clinics.
Hmm.
They started 4 small clinics, and they are actually struggling to meet their daily expenses. I can
Okay.
tell you that entrepreneurship is not everyone's cup of tea,
Hmm.
but it is a skill. I repeat, it is a skill.
Hmm.
This skill can be taught. The
Hmm.
skill can be learned.
Very
You need
true.
to learn
Hmm.
the skill.
Hmm.
Doctors definitely possess a unique blend of this medical knowledge and also empathy, which is a
Hmm.
utmost important skill. And these skill can be a powerful asset for entrepreneurship.
Correct.
And as I told, entrepreneurship is also a skill. The skill can be learned.
Hmm.
However, the success in building a business definitely needs some business acumen.
Right.
And of course, even if you don't have the business acumen, if you do follow the frameworks, if you do follow the research, market
Hmm.
research, and then definitely you can end up with success in entrepreneurship.
Right. Right.
So, in a
Huh.
nutshell, I can say that definitely doctors or physiotherapists, nutritionists, even nurses, any other
Hmm.
person who are into the field of healthcare, if
Hmm.
you if they have the right kind of skill set, if they don't have the skill set, they can
Hmm.
pursue the skill set of entrepreneurship, then they
Right.
can enter into the field and become successful.
Right. So, now, since we're speaking about entrepreneurship, according to you, you have just briefed us about it, but still, I want to emphasize on the fact and ask you again that what are the must have skills for anyone, any medical professional to be an entrepreneur? Definitely, empathy is one which we inherently are built through our degree course, and that definitely helps us stand out, in being an entrepreneur. But apart from that, what are the must have skills?
Yes, there are a lot of skills required by an entrepreneur, but we usually say that for any entrepreneurship, they definitely should have the passion.
Hmm.
Passion is the key. And the second thing I usually say that perseverance. These
Right.
two things should be there,
Hmm.
but it doesn't stop there.
Right.
Even if you have the right kind of passion or a strong passion to do business,
Hmm.
it never guarantee you to become a successful entrepreneur.
Hmm.
You need to acquire more skills related to communication, related to financial literacy, especially in terms of building a business, the ability to build a supporting network, the ability to build a team,
Hmm.
and also last but not the least, that is analytical skill. That's very, very important.
Hmm.
You need to analyze the situations, the market, everything.
Right.
You should be approaching in with an analytical mind.
Right, right. So it will not be wrong if I say that, entrepreneurs are one man or one woman show where, they have to don the hats of every single role, starting from, I think, purchase, sales, getting your customers, talking to them, I think building your team, soft skills, and I think it encompasses everything, right?
No, doctor, I slightly disagree with you in that
Okay,
area. So the thing is
okay,
that when it comes to entrepreneurship, suppose if I am actually going from pillar to post for doing everything, I'm actually not
right,
doing entrepreneurship. I cannot scale my
okay,
business. Okay.
okay,
So let me tell you an example. When I started my business as a small hospital of around some 24 bedded hospital, I was
mm-hmm.
doing the same mistake. Say, I was the doctor there used to treat around some 30 number of outpatient units per day,
Right,
outpatients per day. There was around at least some 20 bed, 20 inpatients will be there. I was looking
okay,
thereafter. Then I will be becoming the manager also.
okay,
So the thing was that I could run that hospital, but I could never scale that hospital to the next level.
okay,
So, when it comes to entrepreneurship, you need to find the right kind of talents to do all these different sets of job.
right.
So, this is
So,
exactly what
yeah,
happened to these doctors when I initially told. So, these
hmm.
doctors are actually doing the marketing, doing the OP consultations, hiring the people. It's actually not going to work.
Okay, right,
So, definitely, you need to build people. I
hmm.
used to say to in my classes, when it comes to healthcare, you are not building business, you are building
Hmm.
people. You are building
Right,
your resources and you are building the satisfied customers or clients. And that people, that means that resources and that satisfied customers build business for you. But if you
right,
are in a tech startup or tech based company, you
hmm.
are actually building technology and that
Hmm.
technology will build business for you.
Right, right. Okay,
So, whoever out
huh.
there would like to join or enter into the field of entrepreneurship,
Hmm.
of course, your idea might be to scale up the business. For scaling up the business, you need people. So, that's
Right,
very
right. So, uh, team building skills are something that we need to acquire,
yeah.
if I'm right. Yeah. So,
Yes,
any tips? Yes, any tips on that?
it's a see for me when I try to build my team,
Hmm.
definitely a lot of people usually coming to the team initially. I need to
Right.
find the right skill set from that resources.
Correct.
Those people who have the right skill set will remain in my team. I need to
Right.
take immediate decisions whenever the people who are actually join my team doesn't have the right kind of skill set. I need to change them. So
Right.
only the same mindset or same kind of if the people are actually on the same page, then only the business will get scaled up in the initial stages.
Hmm. Right, right. Okay. Uh, so coming to, learning about business and entrepreneurship, definitely you said that your time during IIM was a great basic starting period for that. MBA in medical field. I mean, nowadays, we have seen a lot of doctors, dentists who pursue, MBA in different subjects and different fields of medicine. So, what are the different options available for medical professionals to pursue MBA in?
See, as I said initially,
Hmm.
there are a lot of options after completing an MBA course, but
Hmm.
uh, I should say that what kind of MBA or the business management degree, from where you got that business management degree, is very, very important. So by
Right.
just pursuing an MBA from an online academy or any university which provide an online post graduation in MBA will
Hmm.
never work for you, because you are medical
Right.
professionals. You are maybe a doctor. You are maybe a physiotherapist. You should not you're actually professionals.
Right.
So you should go for or do some research. As I initially tell, you should have that analytical skill. Where you would like to reach maybe after 5 years down the line? What exactly is your passion? So
Right.
accordingly select the right kind of college and right kind of courses.
Right.
So once you complete the MBA, as in generally we used to say that there are a lot of options like managing the hospitals, managing the pharmaceutical companies. As I can say that in these days, a lot of technology companies are actually entering into
Hmm.
the field of healthcare.
Correct.
We used to call them health tech companies. A lot of health tech startups are out there
Hmm.
looking
Hmm.
for co-founders, looking for those people who are on the same page.
Right.
If you are a medical professional who are on the same page with that kind of technology startups, then definitely you can join them. Say, for example, your MD, Mr. Shadab, was actually talking to me some days before. When we said about Coach Minister, at some point of time, we realized that we are on the same page. We are
Right.
maybe in some days we will spin out a business out of that same business idea. So
Yeah. Yeah.
what I'm
Sure.
saying is, after completing your MBA, huge options are there. If you are a medical
Hmm.
professional or any allied medical professionals,
Right.
and you should choose the right way from the initial start itself. You need to decide where you want to go and accordingly
Right.
acquire that particular skills. Because, say for example, a hospital management degree or a professional require a different skill set. A
Hmm.
CEO require a different skill set.
Hmm.
A person who manages a pharmaceutical company require a different skill set. A
Hmm.
person who works in a nutraceutical company require a different skill set. So
Correct.
that's why I said that where you want to reach, you need to identify that and
Hmm.
accordingly polish your skills to reach
Hmm.
them.
Right. So when it comes to colleges offering these MBAs, I think IIM stands out as the best, one of the best institutions. What would you
Yes,
say on that?
yes, doctor. IIMs can be the considered as the topmost or tier one colleges in India, but not only IIMs, a
Hmm.
lot of other private colleges are there in
Hmm.
India. There in India,
Hmm.
actually providing um, good kind of education. That means the methodology, that
Hmm.
the study methodology they're actually adopting for their
Right.
candidates. Not only
Right.
IIM, a lot of business schools are out there.
Right. Right. Okay. Perfect. Now, when it comes to being a medical entrepreneur, what are the pros and cons of being a medical entrepreneur, according to you?
Pros and cons means, when you consider pros and cons, pros can be a small one. That means uh, pros I can consider, it's the freedom to make some real impact in the society.
Right.
So you are pursuing your passion. Your
Hmm.
mental satisfaction will be at higher side.
Right.
Okay, you're actually going to make some real impact in the society. So I can bring down it in one sentence. You are actually making some real impact. When it
Right.
comes to cons, as an every entrepreneur, there are a lot of risk associated with it. You should
Hmm.
be ready to face that risk. the
Correct.
initial challenges of funding, navigating the regulations, as I
Right.
initially told, building a strong team, scaling the business. A lot of challenges are there. So
Right.
the cons are high, the pros are actually very low. But I can say the rewards are truly fulfilling, so that
Hmm. Hmm.
always the pros will definitely outweigh the cons.
Hmm. Right.
When you
Okay.
become a
Okay. That's
successful entrepreneur, then definitely the pros outweigh the cons.
right. Right. Okay. So you were also talking about the mistakes
Yeah.
that you did personally, and also you've seen others during your research. So, what, according to you, are the common mistakes that are done by somebody who just begin their entrepreneurial journey?
See, most of the listeners, if they are doctors, physiotherapists, or if they are nutritionists, or any yoga
Hmm.
practitioners, any person from the healthcare field,
Hmm.
when they would like to venture into the entrepreneurship, I can say more 80% of them are planning to start a clinic or their own small hospital like that.
Right.
So many of them underestimate the importance of market research. I repeat the word market research and also
Hmm.
planning.
Hmm.
It is crucial to identify a problem. That means when it comes to entrepreneurship, you are actually going to identify a problem and finding out a solution for it.
Solution. Very true. Hmm.
Yeah. So most of the time, say example, if an Ayurvedic doctor just passed out from his or her graduation, used to think to start a hospital or a clinic in a small town. So let me tell you an example of a one of my friend's brother who have completed the physiotherapy course, and he started his physiotherapy clinic in a
Hmm.
small city here in
Right.
Kerala.
Hmm.
So after 6 months down the line, he had to shut down the clinic because
Oh.
no patients were there.
Hmm.
So when I asked him, he told me that his house was actually very near to the city, some 4 5 kilometers away from the city, actually in the periphery of the city. So I
Right.
asked him why you didn't start the clinic near your home. Even at your home, there was a huge space out there. Why didn't you start? He said that a famous physiotherapist was there near to his home. So
Hmm.
he said that the patients won't come there.
Right.
But this famous physiotherapist is known to me. When I checked with him, this famous physiotherapist, he told me that more than 80% of the patients right now he is actually having doing the consultation are not coming from the nearby areas. They are coming from the
Oh.
cities.
Right. Hmm.
This new physiotherapist need to do some research.
Hmm.
What kind of patients are there in that locality? Is he only expecting the patients from that particular locality only? Because in this digital world you can get patients from US, you can get patients from any
Correct.
part of this world. Okay,
Hmm.
so you should do the market research,
Hmm.
identify a problem. Say for example, instead of going to become a generalist,
Hmm.
yes, of course, you can create a niche area in your practice, whether it is nutritionist, whether it is even physiotherapists, doctors, when it comes to allied medical practitioners also.
Correct.
You can find some niche areas.
Hmm.
Okay. So I was telling you about the market research.
Hmm.
This is very, very important. You need to identify the needs of the customers or the prospects there out,
Hmm.
and accordingly you need to polish your product and services.
Right.
Okay.
I think there is also a famous saying that, people don't look out for products, they look out for solutions to their problems. Right.
Exactly,
So,
exactly.
yeah. So, definitely, as you were mentioning, entrepreneurship is all about identifying the key problem and finding an appropriate solution to that particular problem.
Exactly, doctor. Exactly.
Yeah.
So
Yeah.
last day when I was
Hmm.
traveling, I saw
Hmm.
a clinic. Since you are from dental background, let me tell you that
Hmm.
I saw a
Yeah.
clinic which mentions pediatric clinic, pediatric
Right.
dental clinic. Okay. So it made me some curiosity, and I stopped there. And it was very wonderfully crafted clinic in which they are their customer persona is only children.
Right.
Okay, and they have a lot of amenities for their kids coming out
Hmm.
there. So this is a
Right.
kind of adaptability initially I told you
Hmm.
need to
Hmm.
be have as a quality by these medical entrepreneurs.
Right. Very true. Very true. Okay. So, what, according to you, is the best part of being an entrepreneur?
Best part is it's all about problem solving, you can say.
Huh. Hmm.
It's all about creating some solution that can definitely improve the patient experiences or any
Hmm.
other customers experiences,
Right.
and at large you are actually contributing to a healthier future.
Right.
So the best part is you are finding a solution. It's not
Hmm.
about, when I'm saying entrepreneurship, most of the doctors or most of the medical professionals right now listening me will be thinking about making some money after doing some business. So
Right.
entrepreneurship is not about exactly making money. Making money is just a part of it. It's all about finding the solutions for problem.
Very true. Hmm.
So I was actually thinking about a business in the dental area,
Huh.
dentistry. See, as you know that most of the dental procedures, when you talk to a patient, there are high chance that the patient may skip that dental procedure, because when you say about surgery, don't want to do the surgery. They will
Right.
be feeling very fearful out of it, because why I am saying that, uh, the dentist who treats my mother asked my mother to have some sort of some incision. She was very
Hmm.
afraid of it.
Hmm.
So that's actually a problem.
Hmm.
So if you can identify that problem and find a solution, because when I'm saying that, anxiety from the side of a patient,
Right. Right.
if you can relieve that anxiety, the number of patients coming to this procedure after the doctor is actually saying to the customer about the procedure will be increasing for sure.
Definitely. Yes.
So this is
Hmm.
exactly entrepreneurship. You're actually identifying the problem of the customer, you're finding a solution.
That's an amazing example. That's something that we face day in and day out, as you were mentioning. Because uh, I think especially when it comes to dentists, I can talk about it because we dentists are working on or doing procedures in the oral cavity, in the mouth, on a live patient. I mean, the patient is not, uh, uh, anesthetized generally,
Yeah.
and the patient is well aware of his or her surroundings, and they are well aware of what we are doing, so definitely that anxiety steeps in, and that can become a problem, as you mentioned. That is one area definitely every dentist needs to work on, how to relieve that anxiety of the patient and take him to your side, and then start with the procedure. Amazing. That was a very good example that you could give to all of us. Now, we discussed in the starting of the podcast regarding, changes in the medical education. If we can, slightly bring about certain changes in the medical education in general. So, what, according to you, is lacking in the current medical education in India? And do you believe certain changes can definitely help in more medical professionals being successful entrepreneurs?
Doctor, in my opinion, medical education in India definitely could place a greater emphasis on communication skill,
Hmm.
business acumen, especially
Right.
in preventive healthcare also. As
Right.
every doctor out there definitely will be going to supporting me when I'm saying
Hmm.
this, not the academicians. With all due respect, let me tell you that medical academicians does not know the market requirement most of the time.
Hmm.
They believe if the student scores full marks, they will be the best healthcare practitioners.
Hmm.
But the data says difference. You're all agreeing with me.
Right.
If you're a healthcare graduate, whether a physiotherapist, a nutritionist, think about your class. Is the first, second, third rank holders are making the big changes? I mean, the big changes in the healthcare scenario? Obviously not.
Right.
But what if we equip these top students and all students with the skill sets required by the market? That means by
Right.
the society.
Hmm.
So, equipping the future doctors with these skills will
Hmm.
definitely allow them not only excel in clinical or clinically, but also
Hmm.
navigate the complexities of healthcare system, and of
Right.
course, they can advocate these skill sets for their patients in a more or less effective way.
Right. Right. So
So
these changes
definitely,
definitely. Yeah.
yeah.
Please
So
continue.
definitely, our healthcare education system should adopt these changes that are actually happening in the market.
Hmm. Hmm. I think, as you mentioned, we definitely develop some amount of communication skills because we are taught to treat patients from early on in the degree. But apart from that, many other skill sets are lacking when you directly are coming to the market once you complete your 5-year degree. And such skills, if we are put in, if we are learned in college, if we are taught something about it in college, definitely it is going to help all the medical graduates. Right. So we also spoke about how technology is transforming medical field on a daily basis. For that matter, I mean, we are getting new things and new equipments and whatnot. I mean, it's medical field is transforming on a drastic basis. On a so what? Where do you see this medical field in the next few decades, according to you? Also, do you feel that since we are all shifting towards post covid, I think majority of the population also uh, have a lot of interest in keeping themselves healthy, so these lifestyle modifications are going to be the norm in the future. So kindly share your thoughts on this, how medical and technology can go hand in hand, and where do you see medical field in the next few decades?
So that's a great question, Doctor. See, I always want to answer this kind of question because I believe that the future of medicine is undeniably moving towards a more or less holistic approach.
Correct.
I believe we will see a greater focus on preventive care, especially post COVID,
Correct.
the personalized medicine, and also
Hmm.
leveraging technology to improve the patient outcomes. These are all
Hmm.
happening these days. Lifestyle modifications will play a crucial role in managing chronic diseases and, of course, promoting overall well being of every patient.
Correct.
So, I can say that we have achieved remarkable advances in communicable diseases like infections due to the discovery of antibiotics. But when
Hmm.
it comes to NCDs or non communicable disease, we are still behind.
Correct.
The data says, as you initially told, the prevalence of diabetes is skyrocketing. It is
Hmm.
around 7 percentage. When we consider the pre-diabetic condition also, it is 33
Hmm.
percent. Obesity
Hmm.
is skyrocketing in a country like India. Thyroid
Hmm.
disease, heart diseases,
Correct.
autoimmune diseases, these are all
Hmm.
skyrocketing.
Hmm.
The solution lies not in a single pill or any number of medicine, but lifestyle modification.
Correct.
So definitely, there is a huge scope out there. To
Hmm.
all the medical graduates or the nutritionists, physiotherapists who are all working in this space,
Hmm.
definitely they need to go thorough and in deep with these subjects,
Right.
especially managing this lifestyle disease. The changes are happening. You need to become more adaptable to embrace these changes.
Right. Right. Okay. So here I would like to, ask you, since we're coming close towards the end of the session, closer to the end, what advice would you like to give to all the young professionals and young medical graduates who are listening to us on this podcast as to how definitely you said adaptability is one thing which, and here I would like to add also that, staying abreast with the latest developments in their particular field is also going to help. So what advice would you like to give to the young professionals?
To all young professionals out there, whether they are medical graduates or any coming from any allied medical field, uh, let me congratulate all of them on choosing this incredible profession. My advice is to stay curious and
Right.
always embrace lifelong learning. So,
Hmm.
when it comes to medical profession or any healthcare profession, the things are actually changing day by day.
Hmm.
As you said, you need to be stay abreast with the present scenario. So, never stop exploring the new avenues, especially in the medical field. Always be inquisitive. So at the age of 42 years, I'm also still learning. I'm learning actually a new course in prompt engineering. That means AI. You know that
Okay.
AI is actually going to take the world from now
Right.
onwards.
Right.
Yes, as a medical professional, definitely I need to have some basic understanding how the AI works.
Correct.
And when you are actually following or creating your niche area, especially in the medical field, whether in physiotherapy, whether in nutrition, whether in treating diseases. Of course, always try to acquire new skill set, try to learn new things. Then only your horizon will be actually going to expand.
Right.
So, my simple advice is unlearn and relearn. You
Very
should
true.
always
Very true.
unlearn and relearn. This is always I used to tell in my classes where I'm taking the coaching classes, health coaching classes in my academy, even to doctors, even to various other people who are actually coming into the field of health coaching. I always say that whatever you learned, if it is not at par with the present scenario, you should unlearn it and relearn the new things.
Right. Very
And
true.
if any person out there would like to enter into the field of entrepreneurship, of course, we used to believe that there is a gut feeling. We give more importance to gut feeling.
Hmm.
But as a person, I give least importance to gut feeling. I give more importance to data, data
Right.
analysis. So, what the data says, most of the time, the data will be the winner.
Right.
So, instead of gut feeling is good, that's fine. But if the data says against your gut feeling, always go ahead with the data.
Right.
So especially the historical data or previous data. So when I'm saying in a management jargon, let me explain it in detail. Say, for example, if you would like to start a new clinic or a new venture, you check with the data how many doctors have ventured into this particular domain, how many become successful, how many become failed, and why they
Hmm.
failed, why they become
Hmm.
successful. So analyze this and get into it.
Right.
Yeah.
Okay, so that was an amazing final word that you shared with all of us. So I'm very sure all the viewers who are listening to us today have learned much more about entrepreneurship in medical field, and they're going to benefit a lot from this talk. And I would also like to, invite you for further sessions with us regarding lifestyle medicine and regarding functional medicine. I'm sure you will be our speaker for those further podcasts, and we would love to have you there. So I would like to thank you so much for accepting here and being on this podcast today. And I'm sure a lot of medical students have benefited from this talk today. Thank you so much, Dr. Biju, for being with us today.
Pleasure is mine, Dr. Ranjan.
Yeah. So
Thank you.
good day
Thank
to
you.
you, sir. Thank you.
Same here. Thank you. Thank you. Bye.
Yeah.